Asthma. Asthma is a chronic respiratory condition characterized by inflammation of the airways, leading to reversible episodes of breathlessness, wheezing, coughing, and chest tightness. Causes. The exact cause of asthma is unknown, but it is thought to involve a combination of genetic and environmental factors. Triggers can include allergens, respiratory infections, physical activity, and exposure to irritants like smoke or pollution. Symptoms. Common symptoms of asthma include shortness of breath, wheezing, a whistling sound when breathing, coughing especially at night or early morning, and chest tightness. Symptoms can vary in severity and frequency. Effects. Untreated or poorly managed asthma can lead to reduced lung function and a decreased quality of life. Severe asthma attacks may be life-threatening, emphasizing the importance of proper management and treatment. Treatment typically involves long-term control medications to manage inflammation and bronchodilators for immediate relief during symptoms. Avoiding triggers, maintaining a healthy lifestyle, and having an asthma action plan are crucial components of effective asthma management.